Good afternoon. I'm Mandy Cohen. I'm the Secretary of the Department of Health and Human Services, and I'm joined by Director of Emergency Management Mike Sprayberry. Karen Magoon and Nicole Fox are our American Sign Language interpreters, and working behind the scenes are our Spanish translators, Jackie and Jasmine Matevier. I'm going to start with a rundown of the numbers as usual. As of this morning, there are 17,129 laboratory-confirmed cases in 99 counties, 492 people currently hospitalized, and sadly, there have been 641 deaths. Today, we are issuing updated guidance about who should get tested for COVID-19. Our goal is simple. We want to make sure everyone who needs a test gets a test. The new guidance recommends that clinicians test anyone they think could have COVID-19. This starts with people who have any symptoms suggestive of COVID-19: fever, cough, changes to taste or smell. We also want to test anyone who may have had close contact with someone who is positive for COVID-19, regardless of whether or not they have symptoms. Additionally, there are several groups that we want to make sure have access to COVID-19 testing. This includes people who live in or have regular contact with high-risk settings, like long-term care facilities, homeless shelters, correctional facilities, and migrant farm work camps. We also recommend testing for people at high risk of severe illness. This includes people over the age of 65 and those with underlying health conditions. And because of the disproportionate impact from COVID-19 that we're seeing among communities of color, testing is also recommended for those who come from these historically marginalized populations. We also want to make sure our essential workers whose jobs make social distancing hard have access to testing. That includes healthcare workers, first responders, and frontline workers like grocery store clerks and gas station attendants. A list of sample collection sites is now posted on the DHHS website at covid19.ncdhhs.gov. We can continue to help slow the spread of the virus by remembering the 3 W's: wear, wait, wash. Wear a cloth face covering, wait 6 feet apart, and wash your hands often or use hand sanitizer. I'm so proud of how North Carolinians have joined together to confront this crisis. Your collective actions have saved lives. Please continue to take care of yourself and those around you. With that, I'll turn it over to Director Mike Sprayberry.
Thank you, Madam Secretary. Before I get started with my daily update, I want to say how proud and thankful we are to have Dr. Cohen as our partner. She's been here in the state EOC with us since the very beginning. And not only has she been a great battle buddy, she's also the wife and the mother of 2 beautiful girls. And we're so thankful and glad that they've let us borrow her for this response operation. Now for our update. Good afternoon. Today is day 67 of State Emergency Operations Center's COVID-19 response. Today, a good news story. We began distributing personal protective equipment to more than 3,800 licensed care facilities across the state. This includes nursing homes, adult care homes, and other types of care facilities that need PPE to prevent the spread of the virus among their residents and staff. Regional drive-through sites are being set up for care facilities to pick up their 2-week allotments of face shields, procedure masks, gloves, shoe covers, and hand sanitizer. They will also receive instructions on proper PPE use and instructions for reordering more PPE. Emergency managers and National Guard personnel will staff these distribution sites. Today, we are operating the 2 sites in Martin and Franklin counties that will distribute to facilities in 10 counties. Over the next 2 weeks, we will set up sites in other locations and distribute supplies to all of the state's licensed long-term care homes. This is an example of the vital multi-agency and multi-jurisdiction planning that it takes to address the needs of this event. I want to acknowledge the planning team from DHHS, the Office of Emergency Medical Services, the North Carolina National Guard, and local and state emergency managers. As we continue working to obtain personal protective equipment, the National Guard and Civil Air Patrol teams delivered to 20 counties yesterday. Shipments included procedure masks, gloves, face shields, goggles, and hand sanitizer. Gowns continue to be the hardest to obtain of all the items of PPE, but procuring these supplies remain a top priority for the State Emergency Response Team. I should also mention that the National Hurricane Center is tracking a system off the Florida coast that has an 80% chance of becoming this season's first named storm over the weekend. The only impacts we expect at this time in North Carolina are strong surf and rip currents along the coast early next week, so be careful out there if you're swimming at the coast. This is the time of year when we need to keep an eye toward the tropics and be prepared. Hurricane season officially begins in 2 weeks. Make sure you're reviewing your personal preparedness kit and include items like masks, wipes, and sanitizer. Remember that readync.org has resources and information that can be useful in your planning. I want to thank everyone who is continuing to follow the guidance from the governor and also Secretary Cohen. Because of your action, trends are remaining stable after a week of Phase 1. I also want to give a hearty hand salute to our local health departments, emergency managers, social services, emergency medical services, law enforcement, fire service, and all the rest of our county, municipal, and volunteer agencies who are working so hard to keep everyone safe and healthy. You're on the front lines, and we appreciate you so much. As you're out this weekend, remember your 3 W's. Wear a cloth face covering, wait at least 6 feet apart, and wash your hands often. That's wear, wait, and wash. As always, don't forget to look out for your family, friends, and neighbors, and call your loved ones daily. Guaranteed they'll appreciate it. With kindness and cooperation, we'll all get through this together as one team, one mission, and one family. Thank you, and back to you, Madam Secretary.
Great, thank you. And I'll take the privilege to also thank you, Director Sprayberry, for not only being an incredible leader and getting the job done, but doing it with kindness every day. And so I learned from you, and I'm very appreciative of the team that we have here at the Emergency Operations Center, as well as all those partners across the state that have been working so hard on this. This is like a crisis that we have not seen before. It has gone longer than any other activation of this emergency center. It is affecting our entire state, and I'm just so appreciative of the hard work that continues to go on, and we know will go on into the future. All right, with that, we will open for questions.
For our reporters on the line, please press 1 if you'd like to ask a question. And we'll take our first question from Will Michaels with WUNC Radio.
Hi, Dr. Cohen. Will Michaels at WUNC. Thanks for taking my question. I just wanted to ask, the testing parameters that you just laid out sound like a pretty significant expansion in testing. How many tests are we able to do at this point, and how confident are you that our supply can meet that demand?
Well, thanks for that. We know that this has been our effort over the last number of weeks. When we first started this crisis, we did not have the testing capacity that we need. I was in front of the press multiple times articulating our need for supplies, both at lab reagents and swabs, PPE. What I could say is we are largely in a very different place, and I'll thank Director Sprayberry and the team that's been working day and night on this. I think it's been a partnership on many fronts, and so we feel much better where we are in terms of supply. And now our job over the last number of weeks has really been to ramp up the site collections, the sample collection sites where folks can go and get tested. I think the labs in our state have done a tremendous job of increasing their daily capacity. We've seen many more labs come on board. We've seen the supply chains move. So we're seeing 8,000-9,000 tests done a day, but we know that there's more capacity there, and we want to utilize this. And so that's why we are ramping up, and that's why this new guidance is directing our clinicians around the state, our doctors, our nurse practitioners, and other clinicians to really say, hey, these are our key populations. Please do make sure that everyone is getting tested who needs it. We have the capacity and we want to use it. We could think that's an important tool. And again, we know that this has been an evolving thing as we've moved through this crisis, but now we're in the time where we really want to turn up our testing. Not that we haven't been doing that, but I think this is signaling yet even another escalation of wanting to get to more testing, and particularly those high-risk populations. So we have already been in a place, for example, of testing all of the nursing home residents and staff when there is an outbreak. We're now moving to say we need periodic testing regardless of outbreak or not. We just know that this virus is here. It's getting into some of those high-risk settings. We need to be even more proactive now that we have the supplies, now that we feel like we have the capacity to do it. So we're going to keep moving forward on that. So thanks for the question, Will.
Next question is from Sam Walker with OBX Today.
Good afternoon. Question regarding the testing sites list, which was released yesterday, specifically with regards to the northeastern corner of the state. There seems to be almost no information on that list. And also, Dare County pointed out yesterday, Dare County's Health and Human Service Director pointed out that they have tried to get drive-through or other types of testing sites and have been denied that, and they're going to initiate a local initiative. Can you address those questions?
Great observation, and we certainly have been noticing that too, that particularly the northeast part of our state does not have the sites that we would like to see. We know we need those sites in every part of our community. That's where our partnership with many different types of entities comes along. I really appreciate the Dare County folks who have said, yep, we need to have a local initiative here. It's going to look different in different communities. Certain local communities will partner with a health system or a hospital in their communities to do the testing. Others may partner with a federally qualified health center. Others may use drive-through like a Walgreens or a Walmart. A number of those sites were ones that were not selected by the state, but rather were selected by the federal government in partnership with those corporate entities. But it's our job in the state to now look at that mapping of where those sites are and say, where are we missing and how do we fill that in? So we know we have to rely on a lot of different partners to do that. So that's going to be the ongoing work to continue to ramp that up. We will rely on our local partners. That's Director Sprayberry was mentioning, emergency management, our local public health officials, our county partners. They're going to be so critical in this. And then we at the state want to still make sure that we are filling in gaps even further than that, that that you will see us contract with particular vendors to say, hey, we still have gaps. How do we make sure we're hitting all of the communities across North Carolina? So stay tuned. It is a work in progress. We definitely noticed that the Northeast in particular needs to make sure they have more access points to testing, and we want to work with those local communities to get that going as soon as possible. Thank you.
Next question is from Helen Chickering with Blue Ridge Public Radio.
Thank you, Dr. Cohen. Another question I have two questions. Number one, how do you define regular testing with these new wider guidelines? And then thoughts about sleepover summer camps, which are really big here as phase 2 approaches. The CDC has issued guidelines. I think everyone's waiting for an answer on that.
Yeah. Thanks, Helen. Great question about regular testing. So I think that is where we are still looking at the science to understand what does regular testing mean? What is that interval in which we need to repeat the testing, right? Because we do know that testing is a moment in time. And then folks have other exposures and move through the community and move through their lives. And so we know we are going to have to repeat that. I think our team is still working with our testing surge work group to answer that question in particular. So we know we want to get started on that work, but I think we're still looking at the data and working with our scientists scientists to know how to define regular, which is why it is not yet defined in that provider guidance. I think what we are signaling, not just signaling, but saying in this provider guidance is those populations are really important. We need to be testing them. The question is how often, and I think that's what we're wanting to come back with. And then once we know what the science tells us about how often, then we have to build the logistics and the infrastructure to allow for that to be possible. And I still think there's more work to do in order to build to that capacity. So we are flying the plane and building it as we go here, but it's exactly the right question that we still do need to answer as the science evolves. On summer camp, good news, we just released the overnight camp guidance for folks, so you could take a look at that. Obviously, it's not going to be the same summer camp that folks may have remembered as of last summer, but in phase 2, there is an opportunity for overnight camps to open with some restrictions, and so that guidance is now posted. So we are hoping that a number of camps will look at that guidance and still be able to proceed for the summer. Others, I know, already have made the decision not to, or may look at this guidance and say, it's just not the right thing for our camp in terms of what we provide and how we operate. So we know that this is incredibly challenging. I will say that camp is this interesting, mix of right. It's children, so they are a lower risk population, but they are living in tighter quarters, and it does involve a lot of travel. And we know we have a lot of folks coming from out of state here, and so all of those things needed to be taken into consideration. I really appreciate the camp associations and others working closely with our team to try to get to a place in terms of the guidance that we got to today. So that's posted on our website right now. Thanks, Helen.
Our next question is from Julie Havlack with the Carolina Journal.
Hi, thank you so much. I wanted to ask about the 30-day supply of personal protective equipment. Who does that supply cover, especially now that private businesses will also need some of that protective equipment?
Director Spraber, do you want to start with PPE 30-day supply, and then I'm happy to fill in?
Yes, ma'am. Thank you. And so what we're doing now is we're continuing to purchase personal protective equipment for all the different acute facilities, the long-term care facilities. We're also providing resources to the counties. Every day we're making distribution via the National Guard, via the Civil Air Patrol, and meeting resource requests. We had about 120 resource requests yesterday. One of the things that we're also working on is we're working on trying to determine, as we have more testing and we need more PPE, what does that look like? What does the demand signal look like? So we're working, we have a meeting today. We have some more meetings scheduled for next week. As we expand our testing and tracing capacity, we want to make sure that we have enough PPE. Also looking at, as schools open up in August, or if, what that looks like, and are we going to need more PPE for that? So a lot of different variables that we're thinking about as the situation evolves. What does a 30-day supply of PPE look like for one facility versus another facility? We know that we're also been directed to look at creating a state strategic stockpile of PPE. So a lot of work done on that front. Ma'am?
Great. Thank you, Director. And Julie, the one other thing I would add is that we are working with both with a number of private businesses to make sure they have what they need as they work to get their own supply chains up and running. So we want folks to have what they need, and so we work with them to give them supplies if in a short term. Then if they need to move on and get that more permanently elsewhere. We're trying to help folks know where there are purchasing collaboratives so that they can get into that supply chain. Certainly our hospitals and our medical folks are more used to making those kinds of purchases, but maybe some of our newer business partners, that's newer to them, so helping them get into those purchasing collaboratives and make those purchases. But of course, we want folks to have what they need right away, and we'll always be willing to help from the state perspective.
Our next question is from Micah Henry with the Taylorsville Times.
Hi. Hello, this is Micah Henry with the Taylorsville Times. I have a question for Secretary Cohen. It's about hospitalized COVID-19 patients. Hospitalized patients in China and other countries are being treated with, among other things, high-dose intravenous vitamin C with positive outcomes to help lessen the cytokine storm in the body. Is this being tried in North Carolina hospitals?
Okay, thanks for that question. I'm not aware of any clinical trials related to IV vitamin C, but I will check back with our head of pharmacy and see if anything is going on here in North Carolina. So we will follow back up with you. Thanks for that.
Next question is from Gary Robertson, Associated Press.
Hi, it's Gary Robertson with AP. I had a question to clarify. I'm going back to this new testing protocol. How I read it, and correct me if I'm wrong, Dr. Cohen, if this is not saying that if you live in a nursing home or you're African American that you should get a test. It's that when a clinician is seeing somebody from one of these communities, regardless of symptoms, they should get a test. Is that a more accurate portrayal of what the protocol is, or could you clarify further?
It is more the latter, but let me have a nuance to what you said. So it's not that we are saying you should proactively bring everyone in from those communities. I think it is having the clinicians be aware that those are populations that are more likely to be exposed to COVID-19 or be impacted by COVID-19. And so when they are assessing in their clinical judgment all of the things that they might be considering for a patient that's sitting in front of them, we want them to think about testing in particular for those communities. Because again, COVID-19 has so many folks who have it who don't show symptoms. And so particularly for those high-risk communities, we just want clinicians to have that heightened awareness that there are certain populations that have higher exposure risk, that have higher penetration of the virus in the communities that they live in. And so it's more that awareness raising to clinicians. So when you have someone sitting in front of you, make sure to ask them, like, where are you working? Do you work in a grocery store? Are you a frontline healthcare worker? Do you come into contact, with someone in your household working at a nursing home? So it is really guiding clinician to still obviously use their clinical judgment. We have wonderful doctors and nurses and others here, but I think it is highlighting the importance of those populations and recognizing that this virus can be had by some who don't show symptoms or might have a different profile of symptoms. For example, we know COVID-19 has some more non-specific symptoms like headache or muscle pain. So we want folks to put some of those pieces together. Someone may be presenting without a fever, but maybe presenting with headache or some more non-specific symptoms. And in those higher risk populations, we want those clinicians to think, you know what, COVID-19 test needs to be in my differential here, doctor term, in the list of things that I'm thinking about. And so ordering a test should be part of what I do for this patient. I hope that clarification is helpful. Gary, tell me if we want to do follow-up on that. Oh, we might have moved on already. Okay.
Our next question is from Jennifer Emmert with WLOS News 13.
Hi, Dr. Cohen. This is Jennifer Emmert with News 13 WLOS in Asheville. I was looking for some clarification on the long-term care facilities. During the Buncombe County press briefing yesterday, they had mentioned that they hadn't really received guidance from the state on what the testing protocol should be for long-term care facilities, and so they've kind of come up with their own protocol. Is there a protocol that the state is wanting those facilities to follow when it comes to testing for COVID-19?
Jennifer, thanks for that. So right now, the guidance from the state is to say if you have even one person with known virus, which means before you even have an outbreak, because outbreak is 2 or more cases. So the guidance right now is even if you have one person within that facility, staff or patient with COVID-19, then you want to test the whole facility, meaning all of your patients and all of your staff. What we are signaling in this new guidance is to say that we actually need to go beyond that. And so our team is working right now on some additional guidance to long-term care facilities to give that exact answer. We want folks to do more proactive testing in our long-term care facilities. We're still working out the exact details in terms of how often does that mean. So if you test everyone today, that is just a moment in time. What is the next interval of time in which you need to test again? I think those are the details we're still working out, but I would encourage, and we're going to be asking the nursing homes to come forward with a plan on how do they intend to carry out that testing, both for their patients and others, and then what do folks need in other long-term care settings from the state in order to make that possible. So you're asking exactly the right questions, and it sounds like Buncombe is already moving in the right direction, which is to get to testing more in our long-term care facilities. The question is how often, and that we're still looking at the science and want to be able to make some recommendation. I know our testing surge work group and the scientists there have been looking at this exact question, and we hope to be able to give more guidance on that. But I would say lean in and do more testing of folks is sort of the guidance we're giving. And that's why we are signaling to clinicians today with this new guidance to say, testing more in these populations is really important. Thank you.
Our next question is from Kate Martin with Carolina Public Press.
Hello, Dr. Cohen. This is Kate Martin with Carolina Public Press. I want to ask specifically about inmates at state prisons. Compared to other states, North Carolina is testing a smaller than average percentage of inmates, and about a third of our prisons have yet to test a single inmate. For example, Michigan, which has a similar inmate population, they've tested 16,000 inmates, about 12 times what we have tested. Do you see any need to increase the testing of inmates? Also, why isn't North Carolina releasing more data on COVID in our prisons, such as the asymptomatic versus symptomatic cases, hospitalizations, demographic data, or testing for people on community supervision? I heard what you said about people who live in these settings need to get tested more, but prisoners also have to pay a copay just to see a doctor. And I'm wondering how you're going to test everybody with that in place.
Kate, thanks for bringing that up. I think, as you know, that the folks who run our correctional facilities in the state announced yesterday about a comprehensive testing plan for the staff, and we know that is the way in which virus can potentially enter the prison and correctional facilities. So I think good to prioritize the testing of our workers there, because these are the ones who are coming in and out. So that is a great first step forward. What we have been doing, I know, in terms of protocol since we've gotten to this point, is to say if there is an outbreak, again, 2 or more cases, that is when we do additional testing. And the good news is that we haven't seen other outbreaks in other facilities. And so when you're doing testing based on an outbreak, I think that is the concern. I think what you're going to see as we ramp up testing of our staff, we know we're going to find more virus potentially. Then we'll trace back to where are those staff? Are they in one of these correctional facilities that has not yet undergone more testing? And then we will take the necessary steps from a contact tracing perspective to ramp up testing. I'm not as close to the details on the data side for our correctional facilities, but I will have our folks from the Department of Public Safety follow up on how they are doing data collection there. I know data collection, I will just say, outside of that space is a very manual process, unfortunately, as we work to try to routinize and automate some of that data collection. So I know it's a challenge on that side. I can't speak exactly to the data collection issues in the correctional and public safety space, but we'll have some folks follow back up with you on the data piece.
Our final question today will be from Luke DeCock with the News Observer.
There's a bad connection here. Luke DeCock from the News Observer. Can you hear me okay?
Try. Not great.
Sorry about that. I don't know what's happened here.
Okay, that's
go
a
ahead.
little better. Go ahead. Yeah, go ahead.
Okay. Yeah, no, that's much better. Thank you. I'd like to reserve a follow-up to this, but the General Assembly will be back Monday with more people in the building and no masks required. Why are masks something that are only a suggestion or a recommendation at the statewide level, but are mandated in some places at the local level, like in Durham?
Thanks for that. So we obviously we've been talking about the 3 W's. Wearing face coverings is a very core component to what we are recommending for folks. We know that there are certain circumstances when wearing a mask may not be appropriate for a person given their medical needs. Some people may have breathing issues and such. So we have strongly urged mask wearing, or I should say face covering wearing. That's why we've made it a central component of the 3 W's. I think it is so important. I will just say from a medical perspective, a health perspective, for folks to be doing it. And just to remind folks why, again, it goes back to the fact that so many people have COVID-19 and don't show any symptoms. I think that has been such a learning for me during this. I think the amount of what's called asymptomatic spread, the data has shown that there is a lot of it, and we want to be sure that people who don't even know that they have it, that they're not spreading it to others. And so wearing that face covering, really it is for preventing it from spreading from someone who doesn't know it to other people. And so I'm hopeful that as many folks who go back to the General Assembly next week are wearing face coverings. When everyone can do that together, it actually has the most protective effect, as you can imagine. This is all about collective action together, so I'm hopeful that everyone can wear face coverings, and I think you said you had a follow-up on that.
Yes, please. And on that note, just what protections would be in place for employees who have to stop working remotely or are told to stop working remotely, but may have reservations about going into a workplace that doesn't have that mandate for that collective masking or social distancing?
That's a great question and a hard one to answer, one where we have been trying to work with different kinds of businesses on. We already have essential workers who have to go to work regardless of where we are in this pandemic, whether they're healthcare workers or grocery workers or our childcare teachers. We know we've already had folks who are in that position. The question is, how can we make it the safest possible? And I hate to be repetitive, but it really does go back to this first core principle of keeping the virus low everywhere, right? If we can keep the virus low everywhere, then we're going to be able to keep things as safe as possible for those workers. And it does still go back to the social distancing, hand hygiene, and face coverings that we keep talking about, the 3 W's. So as far as other people returning to work, we know that this is hard. Now, different people have different risks. We can give guidance for, businesses at large, consumers at large, individuals at large. I think then people need to think about their own personal risk and then discuss that with their employer. So, for example, if you are someone who has underlying chronic conditions or may be fighting off cancer, that may be a conversation you need to have with your employer to think about, are there any accommodations that the employer can make? It can't happen in all situations, we know that. But if you do need to go back, what are the safest ways in which you can? Can you go from maybe a consumer-facing activity to maybe something in the back office, right? So those are hopefully the conversations that many employers are having. I know they want to protect their own staff and their employees. I just think everyone needs to use really good judgment. We don't have all the perfect answers here. We're going to learn more as we go. I would err on the side of caution, particularly for those who are at higher risk. Have those conversations with your employer about your risk in these situations. And I'd implore everyone, I think when we act together and keep the virus level and spread low, that's what's going to protect us all as people do go back to work, which we know they're going to have to. We know, I'm so thankful to all the essential workers who have been working this whole time. We just go back to the three W's. I know you're going to get sick of hearing them, but it's so core and foundational. So with that, I hope you all enjoy our beautiful and very warm weekend that is coming up. Please remember your three W's as you do that, and then we'll be back next week with additional updates and obviously continue to look at our trends as we head into next week and to the end of the week to know more about phase 2. All right. Thank you so much. Have a good weekend. Stay well.